Well, good afternoon, Dr. Steve. Dr. Steve,
That's some
known
opening.
as Weird Medicine. I guess I could be referred to as Weird Lawyer too, I suppose.
Yeah, all of a sudden I
Anyway,
felt like I did something wrong.
well, what's really important is the subject we're going to talk about today.
Okay.
And I didn't really realize the depth of it until I started doing research, even though I have Parkinson's myself.
Yeah.
And I wasn't really aware of a lot of the ramifications, history in medicine. So I'm delighted that you've taken the time out of your day, because I know how busy you are, to kind of explain to the lay public a lot of the things that they've heard but don't know what they mean.
Sure.
So
Happy to.
tell me a little bit about who you are and what you do.
Well, I'm a board certified physician. I'm editor-in-chief of a national medical journal, but more apropos to this discussion, I'm host of a first and still only uncensored medical show in the history of broadcast radio on Sirius XM. It's called Weird Medicine. Been doing it it started on the Opie and Anthony show in 2004, and then got on their channel in 2007. So, 2027, it would be 20 years that I've been doing that show. But actually, I'm very happy to be here with you today because a mutual friend told me about what was going on with you, and anything I can do to help, I'm here for you. And you explained to me, we'd actually met before, but it was audio only, so we've never actually been on where we could see each other. So I was on your old radio show.
Progress is being made. In fact, I know Anthony Cumia very well. I've been on his show a number of times, and he's been on mine. Very bright guy.
Oh, yeah.
Nice guy, too.
It's really quick, really funny. Not everybody agrees with his positions on things, but I was telling your producer that my friends and I don't have to agree on everything. We're allowed to have differences of opinion on certain subjects, and we can still be friends. And he's one of my better friends. I love the guy.
Well, this is a very important month. It's called Parkinson's Aware Month.
Correct.
Which means we're finally devoting some time and attention to something that affects, according to the research that I've done, over 6 million people have Parkinson's of one degree or another.
Yeah.
And so it's out there.
Yeah. Globally, it's probably closer to 10 million. It's at least 1.2 million in the United States. By like 2030, it'll be that many. It's not an uncommon disease. It's common enough that most everyone knows someone or has known someone that's got Parkinson's.
Well, that's kind of interesting because I was looking at some of the research, and I was surprised about some of the people who are identified as people having Parkinson's, including former late President Bush, Janet Reno, Brett Favre, obviously Michael J. Fox, right? Neil Diamond. I mean, we're not alone, I suppose. As I mentioned before, I think before we went on camera, I have had Parkinson's myself.
Wow.
So I can relate somewhat.
Yeah.
We're going to talk about what is it. Tell us what is Parkinson's?
Well, Parkinson's a degenerative disease of the nerves, and it's caused primarily by a loss of a specific set of nerves that produce a chemical called dopamine. And that's what we call a neurotransmitter. In other words, a chemical that goes between nerves, sending signals to other nerves, and it primarily controls movement, although dopamine is important in other things as well. But in that part of the brain, it's basically controlling movement. And it could be, we're not 100% sure still what causes it. There is a genetic component. There could be toxins like herbicides and insecticides that may contribute to it, which, Judge, you and I are probably close to the same age. Do you remember the days when they used to go through our neighborhoods blowing out DDT behind these big giant trucks? And
sure.
we would run behind them and thought it was hilarious because you couldn't see each other. And then, of course, we find out DDT doesn't ever leave your body. It's fat soluble and it sits there. God knows what it's doing, but it may be contributing to these kinds of things.
Well, it's kind of interesting. You said you were about 70 and you think I'm this close to the same age. Thanks for the compliment. And that really is. I love hearing people say, you don't look your age. It's a very nice compliment.
No, you look like I think we look pretty much the same. If you're a lot older than me, then that either says something about me or something about you. I think it just says you look young.
Well, I am a lot older than you are.
Are you really?
Yeah.
Okay. Well,
but
good for you.
Bottom line is, I want to talk about what Parkinson's is because I want the public to understand what it is.
Sure.
That they don't understand.
Yep.
And what the remedies may be. In fact, one of the first things I noticed when I started to do the research was people say that you don't die from it, but you die with it. So that it's not necessarily a fatal disease. It's treatable.
Correct.
To the degree that treatment applies to you.
Right.
But it's not exactly something you want to have in your life.
That's
so
right.
How does Parkinson's generally, and I know it's a general question, how does it generally manifest?
Yeah, well, and I'm sure you can speak to this better than I can, but the textbook sort of presentation of Parkinson's in medicine is people come to you with tremor and rigidity, and they'll have some rhythmic shaking, usually starting in the hands or the fingers. And then they'll get this thing called bradykinesia, which is a fancy medical term, just means slow moving. They're not able to move as quickly as they were before, and it makes simple tasks more difficult. And we will often start making the clinical diagnosis by flexing and extending someone's arm at the elbow, and they'll have what's called ratcheting, where it moves sort of in a jerky motion, even when you're just passively moving the arm. They'll get this muscle rigidity, and then may start losing balance and coordination, increasing risk of falls. When you're in the shower and you close well, you don't have to worry about this, but when you're washing your hair, and then you close your eyes, you might fall over in the shower. Those kinds of things is usually how it manifests. Now, it's not just about the tremors and the bradykinesia and the muscle rigidity and the discoordination. Things like depression and anxiety can be manifest as well, because we know certain dopaminergic, meaning drugs that increase dopamine can be effective antidepressants as well. So it makes sense that if you're affecting dopamine, it might cause depression. Difficulty sleeping goes along with that. Some people will lose their sense of smell even. Now, ultimately, there are some people that lose their memory, and that's sort of extreme. There's this thing called Lewy body dementia that starts with dementia and ends up with rigidity. And then you have the sort of Parkinsonian dementia, which they're basically the same thing. It's just they manifest slightly differently. That starts with rigidity and ends up having some dementia. So those are all those things. And it usually starts mild and then over time tends to get worse. Now, as you said, people with proper treatment, people with Parkinson's can live a normal life expectancy. It's if they, transition into the dementia phase where things start to get a little dicey. But up until that point, it's extremely, as you figured out, extremely uncomfortable and inconvenient. And if you're a piano player, it can be devastating. But it is, we do have treatments for it.
Well, I can honestly say that when it was first diagnosed, I was still sitting on the bench then, and it made no difference whatsoever in my ability to research, memorize, or do it. In fact, I never mentioned it even to my clerk or the bailiff or the mediator that was assigned to my courtroom. Yeah. So I can say without any question, as an optimist to the public that's listening, it does not necessarily have to affect your mental capacity.
Correct. Those are not the the typical Parkinson patient, but it can happen. So it's important to be aware of it, but it's not something that I would dwell on if I had Parkinson's, because until we have a blood test that says, oh yeah, this is going to progress to this, and a treatment to prevent it, it's just the best thing to do is treat it and just live your life, every day.
Well, that's what I was going to get into with you, is part of the treatment, because
Sure.
that's the hope for the future for all of us.
Correct.
And the reason why we've been doing this show. In fact, I was telling a group of people, I do boxing as part of my
that's awesome.
3 days a week.
The worst thing someone with Parkinson's can do is to go, okay, I've got Parkinson's, I'm just going to sit on the couch. That really is literally the worst thing that you could do. Motion is lotion, which is what my physical medicine and rehabilitation specialist friends tell me. And I believe that, being active, you told me the rock steady boxing, is that what it is? And that's specifically designed for Parkinson's people, or patients with Parkinson's, right?
It is actually. What's kind of interesting, because I look at things oftentimes in a structural sense. Mm-hmm. The program, which the actual class, if you will, is about an hour and 15 minutes, and starts with cardiovascular exercise, warm up. Then we do boxing for half an hour or so. Then we either do weights or throw a ball or whatever it is. And we count out loud a lot, because I understand that Parkinson's has the potential for affecting your voice.
Okay, sure.
Speaking much softer.
Yep.
So we yell basically just the numbers. And the boxing, because we do various different routines and different timing, it requires use of your memory.
Yeah.
And how you jab one, cross two, et cetera. So it's for memory as well. The weights are for the physicality, and then we end up with stretching.
Yeah.
So it's a wonderful program. I'm not doing a promo for them, but
you should. I think it's awesome.
They made a big difference.
Do you know who developed that program? Because they should get some sort of medal for that. If they gave Nobel prizes for effective, fun modalities for Parkinson's disease, that person would get that, because it's brilliant. It's exactly what a patient with Parkinson's needs.
I don't want this to be a promo for rock steady walking, but the bottom line is that's what it is. It is a promo. Yeah. And I've seen the difference in people. We have 20 people in our class. We all have Parkinson's.
Yeah.
And so the bottom line, I've seen differences in people's balance. I've seen differences in people's speaking abilities.
Yep.
I've seen differences in terms of rigidity or the lack thereof. And so that's one of the modalities, I think, that makes the most sense. But why don't you tell us, as a physician, how do you treat people with Parkinson's? And I realize that this is a matter of degree. There are mild symptoms, and there are severe, including effects on the memory and the brain and all of that. So why don't you tell us what you, as a physician, think is the appropriate way to treat people with Parkinson's, at whatever degree they're at?
Right. Well, I am what they call an allopathic physician, which means a traditional Western type. Did I say musician? I am a musician too. Physician, and so we, allopaths tend to treat diseases, although we're working more toward prevention. Although we don't have a good prevention for this disease yet. But some of the medications that we would use are things like levodopa. This is a very effective medication, which has a limited lifespan in a lot of people with Parkinson's. But in the beginning, if you listen to Michael J. Fox talk about it, the first time they gave him a dose of this stuff, his rigidity went away and his tremor went away. He's like, okay, I'm cured. And it doesn't work that way, but it is very effective in the beginning, and very surprisingly so for a lot of people. It's converted to dopamine in the brain. So it's just, replacing the missing dopamine. Then there are the dopamine agonists out there that mimic dopamine effects in the brain. So they're not dopamine, but they act like dopamine at the receptors. And then there are these other drugs called MAO-B inhibitors that prevent the breakdown of dopamine. We use those. The neurologists use those more than, say, a primary care person would. And then there's this thing, which was when I was a kid, the first time I ever saw surgery on television, they were doing this thing, which was deep brain stimulation, where they actually take a stimulator and they put it down into the brain, and they put these electrodes in the brain to reduce these motor symptoms. So, but I go beyond sort of the pill and surgical intervention thing. I send my patients for yoga, sometimes hot yoga. I like the boxing thing. We don't have that here. Maybe we need to start that here. I think that's brilliant. And acupuncture. I've got a friend who is he's my partner on the radio show, Weird Medicine on Sirius XM. And he is a traditional Chinese medical specialist. So he didn't just take some weekend course in acupuncture. He did a 4-year curriculum in traditional Chinese medicine, and he's had some very good results treating Parkinson's patients with a variety of things, including acupuncture. And physical therapy, occupational therapy for people who have some permanent loss of function. Occupational therapy are the geniuses, because they're the ones that come up with the robotic arms and the robot claws and all the assistive devices and stuff like that. It's, the people hear occupational therapy, they think, well, it's going to help me do my job. It's really not. They're there to augment someone's natural abilities by the use very often of devices and things like that. Now, if you want to talk about experimental stuff, cutting edge stuff, stem cell therapy, they're exploring the use of stem cells to replace the loss of those dopamine producing neurons. Because think about it, stem cells are basically cells that can become anything. Because our whole bodies come from one cell. The sperm meets the egg, and we do the butter, the birds and the bees talk, but there's one cell that divides and then starts to differentiate based on where those cells are when they divide. And the next thing you know, you've got a human being with heart and lungs. And so you can take those precursor cells and turn them into anything. And wouldn't it be nice if we could transplant someone's own stem cells back into their brain and have them create dopamine, creating or producing cells that would essentially be a cure. We're doing the same thing for diabetes, looking for stem cells that we can, or islet cell transplants, so that the pancreas can start producing insulin based on signals from the outside, i.e., blood sugar. Gene therapy, they're looking at modifying genes associated with Parkinson's to slow the progression. That's pretty far in the future, and it's almost Star Trek type stuff. And then drugs that just target the abnormal protein aggregation. You get these abnormal proteins that build up in the brain. If you can either dissolve those or prevent those from forming, you can arrest the course of the disease. So those are all sorts of things that we're working on. When I say we, people way smarter than me are working on that, but people in the medical field are.
What exactly is dopamine?
Yeah, dopamine is a thing called a neurotransmitter. We got a bunch of them in the brain. When you have two nerves and they want to communicate with each other, this nerve ending will send a chemical across this gap called the synapse to this one where there's a receptor. And depending on the neurotransmitter, it may send a different kind of signal. So there are, acetylcholine receptors, there are serotonin receptors, there's norepinephrine receptors, all kinds of things. And they all have different functions in the nervous system. And dopamine is just one of those. And it affects mood and motor function. So that's all it is. It's just a chemical that one nerve produces to send a signal to another nerve. And when that breaks down, then that whole circuit is not going to work properly. And we see the same thing in depression, where right now probably the most popular type of antidepressant drug, and it doesn't work for everyone, is a serotonin norepinephrine reuptake inhibitor. And what that means is that the nerves, when you send out serotonin, this one will take it back up after the signal is transmitted, right? Well, if you prevent the reuptake of that drug, then it's the total amount of serotonin in the brain is going to increase. And so what we're really doing is, they did biopsies on animal and human models of depression and found that they had low doses of low amounts of serotonin in the brain. So now we're giving them medication to just dump buckets of serotonin into there and hoping that it will help with depression. And sometimes it does, sometimes it doesn't. But that's kind of where we are with this too. We're just dumping buckets of dopamine into the brain and hoping that the right neurons will pick it up and use it. So it's not a very specific treatment. That's part of the problem. But go ahead.
Well, it seems to be the drug of choice is carbidopa levodopa.
Correct. It's got a lot of side effects, as I'm sure you figured out. Go ahead.
Well, I've been taking it since I had the diagnosis.
Okay.
What exactly does that drug do, and what are the side effects?
Well, carbidopa levodopa basically is converted. You can't take dopamine as a pill because it won't get into the nervous system properly. It'll get broken down before it gets there, or it won't cross the blood-brain barrier, the fragments and stuff. But levodopa will, and it's converted to dopamine in the brain. And then, so, like I said, the answer is just dumping buckets of dopamine into the brain, hoping that those neurons that are still there will get the signal and will work a little bit better. It's got a lot of side effects, though: dizziness, loss of appetite, diarrhea, dry mouth, constipation, changes in sense of taste, and sometimes it can cause people to be forgetful or confused. So but it is probably the most effective drug that we still have, and it's one of the older ones too.
And is there any real danger in taking that medication?
Well, if it's causing you to be forgetful and you're driving and you get confused, then there could be some problems there. But it's relatively well tolerated until it's not. And then what happens is sometimes it gets you get tolerant to it, and you have to take more of the drug to get the same effect, and then you get more side effects. And after a while, it becomes rate limit, or there's a rate limiting step where you just increasing it any further isn't going to help. But in the old days, that usually meant the person ended up stiff and tremulous and had a really poor quality of life. But they've got these other drugs that they can use now, including the the dopamine agonists and the MAO-B inhibitors and that kind of stuff. So
I was talking to a gentleman not too long ago, and we're going to do a podcast with him that deals with some kind of machines that look like one of those things you strap around your neck when you're taking heart tests. And he told me that they're using that because it kind of distributes the dopamine mechanically. You familiar with it?
I'm not familiar with that. That's very interesting. I will watch that show because I'm interested in that kind of stuff. There can be some really serious side effects from carbidopa, like anything else. People can have an allergic reaction to it and get hives and get weakness, numbness. They can even get GI bleeding, rarely. So anytime someone takes a drug, the pharmacist and the person prescribing it need to talk about the risk, benefits, and alternatives to it, so people are well aware of it. But most of these things are rare. Most of my patients who have taken this drug tolerate it, like I said, until they don't, and then we have to go to something else. Very often they end up at the neurologist's office at that point, because it's a little bit, sometimes this gets beyond just the typical family medicine person. When I was first training, we had to do all this stuff, and now there are neurologists everywhere. And so we want to use them because they have specialized knowledge when dealing with things like Parkinson's disease.
I can tell from talking to you, and we've basically never talked before except that radio show years ago. It sounds to me like you're an optimist. Are you?
Oh, I am. Yes, absolutely. I'm a social optimist too. I firmly believe things are going to get better in this world. And I may be crazy to think that, but I can't live any other way.
We'll have to give you a different drug for that.
Right.
To make you happy.
I did plenty of that.
I guess there are happy pills out there.
Sure there are.
Yeah. I also read, doing research, that people who drink a lot alcohol, it has a negative effect. Is that accurate?
Alcohol and as it is associated with Parkinson's disease.
Yeah.
Well, obviously excessive alcohol can, exacerbate the symptoms, and it can interfere with the medications as well. But, moderate alcohol to mild to moderate alcohol consumption shouldn't directly worsen it. But if you're already discoordinated and then you drink alcohol, you're more likely to fall and hit your head and kill yourself. So you have to be, you got to go on a case by case basis on that.
So a martini with dinner is okay.
Well, okay. Maybe it depends on the patient. You got to talk to your prescriber about that. I don't want to say blanket it's okay, because there's some people it's not okay. And that'd be people with more severe disease or people who are prone. And, some people need to be sober. They should stay sober. So, I've never encouraged drinking. There's no, the World Health Organization states, and I take some issue with this, but they state that there's no safe dose of alcohol, that alcohol increases risk of cancer. There are some studies that say alcohol is cardioprotective, but how do you weigh those two things? And they just say there's no safe dose, meaning they're not going to take a stand on that. I'll tell you something that's weird, and this is off topic completely, but there is a disease of alcohol, people with, substance abuse disorder who are abusing alcohol, called Wernicke-Korsakoff syndrome. It could be prevented if we put thiamine in certain, cheaper wines and stuff that people that on the streets may drink. But the FDA a long time ago said, no, you can't do that, because then you'll market it as being good for you or better than other alcohol, and they don't want to do that. So, these people are still just being exposed to this Wernicke-Korsakoff syndrome that could maybe be some of them could be prevented by putting the right vitamins in there, but they won't do that. And that's kind of like saying, well, we're not going to offer contraceptives to teenagers because it's going to encourage them to have intercourse. But the fact is they are having intercourse, and it would be, in my opinion, this is my opinion, sex education and having access to contraception would prevent unplanned pregnancies. So it's that kind of thing. Yes, some people can drink with Parkinson's, we could say that, but you got to talk to your prescriber to decide if you're one of those people. How about that? I went very far afield with that. Sorry, I tend to.
Well, we were talking about balance,
yeah,
and I want to go back to the rock steady boxing.
Yes,
because part of the exercise, or the program, if you will, deals with balance. We do certain kinds of exercises, whether it's squatting or whatever it may be, that enhance your ability to have better balance.
Yes.
Have you had that experience? Have you seen that occur?
Yeah. And where I go with that here, because this is the first I've heard, talking to you about this rock steady thing, is yoga. They do a lot of balance in yoga as well. And you can do balance classes. I went to a wellness retreat, and one of the classes they had was just simply balance. I've got peripheral neuropathy, so I have trouble with, I can't walk a straight line anymore. I didn't know that till I went to my neurologist's office. And by the way, my neurologist said, well, there's nothing you can do about it. And I said, the hell with that. So I went and researched some nutritional supplements for peripheral neuropathy that have really helped me quite a bit. And I wonder if some of those might be helpful for people with Parkinson's disease. One of those is lion's mane. I don't know how many, if you know anything about this, but lion's mane mushroom, the extract from the fruiting body itself, has known regenerative properties. And it's really been very helpful for my peripheral neuropathy and my balance. But I wonder if it would be helpful in Parkinson's, and I've never even looked that up. So I'm doing it now.
I can say maybe you're inspired now to
Yep.
look into it.
Yeah, it just says here that the research says it could be relevant for conditions like Parkinson's disease. Certainly wouldn't hurt anything. Lion's mane's been shown to possess neuroprotective properties, and it may help keep some brain cells from damage. I take it every day. First thing I noticed, I could wash my hair without falling over, But anyway, yes. Back to your question. I'm sorry. I ramble and I have ADHD and I see a shiny object and I go chase it. But we use. I've been using yoga for that same purpose, the balance, regaining balance, and just optimizing what you've got left. That's the thing. Those neurons that are still working, you can optimize them. It's just like doing Sudoku to prevent dementia. You're optimizing those circuits so that if you do lose a few of them, you can afford to, because now you've got some headroom on your balance or your memory.
So there's some regeneration.
Well, yeah, either regeneration or you're just using what you've got to its fullest potential. Again, if you have Parkinson's and you just sit down, you're going to lose motion a lot faster than someone that's doing what you're doing, and you may have exactly the same level of disease, but this person's going to have trouble moving, and you're doing everything, you're living your best life doing whatever you want to, because you're optimizing the neurons that you have left. Is it helping to arrest the disease? I don't know. Maybe, how would we know that? The only way we would know is if we did serial brain biopsies on someone like yourself that's doing something like this compared to someone else. It's kind of an unethical clinical study to do. Now, in the future, a functional MRI might do the same thing as a brain biopsy, where they have real-time MRI where they can see how parts of the brain are actually functioning. And maybe you take two people with the same stage of Parkinson's, one is sedentary and one's doing a boxing or yoga program, and you put them in the functional MRI and see if things are different, if the rate of progression is slower in someone like yourself. But it could be, in your case, it could be self-selecting, that your disease is progressing slower already, which allows you to do something like a boxing program. And that's the thing that's hard to tease out in science. We have to correct for those sorts of biases when we're doing a study like that.
Is there a particular schedule that applies from diagnosis until wherever? Or does it, some people progress better or worse?
Yeah, there are 5 stages, and people will progress through those stages at different rates. And some people never get to stages 4 and 5. And so it is different for everyone. It's a little bit, if you think of Alzheimer's, for example, as a disease where people tend to fall through their 7 stages of Alzheimer's. These stages are artificial. It's just how we can classify people, but they'll tend to fall through those stages in a linear and smooth fashion. But everybody's a little bit different. I had a professor in medical school that took forever to progress through his stages, and he was still teaching when he had the early stages. He was such a genius. This guy had an IQ of 220. If it was 50, it was 220. And when one of the early stages of Alzheimer's is that you can't name things. You'll say, what's this? They'll say that's a thing that you write with, and they can't come up with the word pen, but they could say it's a thing you write with, or this, it's a thing that you tell time with. And when he got his, he described a deck of cards. He couldn't come up with a deck of cards. He called it a concentric stack of thin laminates. And that was one of the first signs that he had some emerging dementia, but he was so brilliant. He came up with a description that maybe you could, but I could never have come up with. It's amazing. So everybody's different in that regard.
Why are you optimistic?
I don't have an answer for you on that.
Tough question, of course.
Yeah, it is. Why do we think a certain way? I don't know. I was brought up that way, I guess. I had an interesting sort of non-traditional childhood, but emerged from that. I do want to show you something, if I can bring this up really quickly, because my dad, who was pretty conservative at the time, never thought I was going to amount to anything, because I was in the 60s. I was a big hippie, freak. And I've got a picture of myself from back then, and you could see why he was maybe a little bit concerned that his son wasn't going to ever do anything. And, in my family, I was stupid Steve, not because my family was mean, but because that's how smart they were. And so that was me. And I wouldn't go smile for the man, you know what I'm saying? So, but anyway, and I didn't think I was going to amount to anything either. And, one day this guy came into my ham radio shop. I was selling CB radios and ham radios. And this guy came in wanting me to help him put up an antenna. And he was literally the dumbest guy that had ever come into that store. And I did help him, and he became one of my best friends. Turned out he was a doctor. And I said, well, heck, if he can do it, I know I can do it. And I think that's where that came from, because I didn't allow my, what I perceived as my dysfunctions to stand in the way of a goal. And that's always kind of been my way. I had horrible panic syndrome. I worked my way out of that. And I never thought I was a strong person, but I never stopped going to work. I didn't become agoraphobic like I could have very easily. And so, yeah, I've always just been an optimist. I don't know, it's one of those crazy things.
Well, going along with the optimism without giving it a description or a classification, what do you think is going on in medicine today that is getting us closer to a positive resolution?
Medicine today is so conflicted. On the one hand, we had this pandemic that politicized medicine to the point where I've never seen it like that before, where all of a sudden there were sides to this thing. Even during the 80s, when we were elucidating the HIV virus, there weren't sides like this, like to this degree. There were factions here and there, that were, out of the mainstream. But for the most part, everybody was looking for a solution. But all of a sudden we have sides, and we see science evolving right before our very eyes, which we've never seen before. And it was very confusing. And, there's still sides. People are still having sides about, vaccines and things like that. On the other hand, I used to say we were 100 years away from a generalizable cure for cancer. And now we're literally taking white blood cells out of people's bodies, training them against their own tumor cells, like taking a sock and telling the dog, go find Timmy, with Timmy's sock. And telling the white cells to go find those tumor cells and kill them. And they're doing it. It's called CAR T cell therapy. It's chimeric antigen receptor T cell therapy. And I'm saying 10 years from a generalizable cure for cancer at this point. That is probably optimistic, but when I first published my first article on my website about it, it was completely experimental. Woman had stage 4 cervical cancer. Which is, she was terminally ill. They said, do you want to try this? And she was like, heck yeah, I'll try anything. They did it. She's walking around today, cancer free. They're giving measles vaccine to people with multiple myeloma, and the human body is going in and killing all of the myeloma cells that are infected by the measles vaccine, which is a live vaccine. We're very, very close. So on the one hand, we have this fracturing of the the political spectrum of medicine, where there are sides, and then on the other side we have these amazing advances, and neurology is the next and really last frontier. Cancer will become an immunology problem. The age of chemotherapy, we will look back on that and saying how barbaric that was, although it's very effective. We're going to do better with immunology. And neurology, I mean, Judge, we don't know how consciousness works, so when it breaks, it's hard to fix it. And we need to learn more about how the brain actually works, stop and have more specific therapies, and just stop dumping buckets of chemicals into people's brain. And we'll have more specific therapies. I'm excited about the gene therapies. I'm excited about diseases to stop the neurofibrillary tangles of dementia, that maybe we can stop that disease dead in its tracks. And it's coming. I am very optimistic about. If we can keep from blowing ourselves up and doing something stupid, then we can have a Star Trek universe, not too far in the future, where we're more disease free. We got to get rid of these viruses too. Pathogenic human viruses have no purpose. We need to eradicate them. We eradicated one of the influenza strains during COVID. Just by social distancing. That actually worked for one of the influenza strains. It's not been seen since. It's gone. So we know we can do it. Smallpox was pretty easy to do. It took a concerted effort, but it was easy because smallpox doesn't have asymptomatic carriers. And the vaccine works very quickly. So you get somebody with the disease, you go vaccinate everyone around them and leave everybody else alone. And it creates a moat around which the virus can't go. And we haven't had a smallpox case in this world for many years now. So those are the kinds of things we've got to do. We need to have a Manhattan type project in that regard. But
I just want to mention, and I'm not that familiar with it, although I'm now motivated to become more involved in it, is the Michael J. Fox Foundation.
Yes.
They are doing phenomenal work from what I can see, the little research I've done so far. Yeah. And I'm not out promoting any businesses or even nonprofits. But this one I want to talk about in the most glowing of terms.
Yes.
They're doing the yeoman's job to make things better for all the people who have the disease or might have it in the future, at least from a proactive standpoint. And so I want to encourage our audience to look into it and get involved if you can. It may very well be, in fact, it looks like it is going to be the wave of the future for all of us. So on that note, I want to thank you, Dr. Steve from Weird Medicine.
Thank you.
Being on the show now that we can see your face.
Well, I have a face for radio, I do want to mention we did miss a very notable celebrity with Parkinson's disease, and that was Muhammad Ali.
Oh yes, of course.
And I met him when he came to University of North Carolina, Chapel Hill, and he was a fascinating guy, and he liked to do magic, but he felt because of his Muslim faith that it wasn't proper to fool people, so he would do magic tricks and then show you how he did them. And but he was so funny and so just a very inspiring person. And I just want to make sure that we mentioned him. And the Michael J. Fox Foundation, this is when celebrity is used correctly, in my opinion. There's a lot of celebrities. I'm not impressed with some of the things that they use their celebrity for. But those kinds of things, Michael J. Fox has done amazing work with the Parkinson's Foundation and advancing the science in Parkinson's disease. And I think you may not want to promote foundations and stuff, but I think it's totally fine to do that. That one is worth sending your money to, in my opinion.
Well, I agree with you. Okay. And I think it is something that we really need to pay attention to.
I agree.
Instead of some of the nonsense that we throw our money at.
Yeah.
And I want to thank you again for being a guest. And I'm going to tell people about you.
Oh, thank you. Thank you.
And
Likewise.
next time I talk to Anthony Camilla, I'll mention we spoke.
Well, and I will too. Actually, I'm going to be seeing him very soon, so I will. I'm glad to know we have a mutual friend.
Well, give him my regards.
I will, absolutely.
Okay. Be well, Doctor.
Okay.
Nice talking to you. Thank
Take
you.
care. You too.